In this case, a child is having several teeth worked on. We'll focus on the deciduous canine. The diagnosis suggests a pulp cap is required. In this case, the decay is being removed from the distal side of the tooth. With the decay gone, the pulp exposure is evident. The tooth-colored ProRoot MTA is being placed over the exposure with the MTA carrier. A second placement completely covers the pulp. A cotton pellet is used to clean up and smooth the ProRoot material. A small amount of light-cured resin restorative is placed directly over the MTA and immediately light-cured. Acid etching the tooth structure must be done with the MTA material protected. After the site is washed, a bonding agent, in this case Prime and Bond, is used prior to the placement of the resin restoration. The restoration completes this tooth.